Welcome to our channel. Today we're diving into the groundbreaking use of Andexanet Alfa for reversing the effects of factor XA inhibitors like Apixaban and Rivaroxaban in patients experiencing major bleeding. This video covers the crucial findings and what it means for patient care. Let's get started. Direct oral anticoagulants or DOACs, such as Apixaban and Rivaroxaban, have become popular for managing conditions like atrial fibrillation and venous thromboembolism due to their convenience over traditional anticoagulants. However, a significant limitation has been the lack of an effective reversal agent for these medications, especially in emergency bleeding situations. Andexanet Alfa, a recombinant modified human factor XA decoy protein, has been developed to address this gap. By acting as a decoy, it binds to factor XA inhibitors and effectively neutralizes their anticoagulant effects. This video focuses on the Andexanet trial, which provides critical insights into the real-world application of Andexanet Alfa. The Andexanet trial, a single-arm observational study, enrolled 145 patients with acute major bleeding who had been on a factor XA inhibitor within the previous 18 hours. The trial primarily aimed to assess the efficacy of Andexanet Alfa in reducing anti-XA activity and achieving hemostasis. Patients received Andexanet Alfa as an initial IV bolus followed by a continuous infusion. The dosage varied based on the timing and type of factor XA inhibitor used. Let's look at the key results. In patients taking Apixaban, the study observed a 94% reduction in anti-XA activity with the Andexanet Alfa bolus, compared to just 21% with placebo. For Rivaroxaban, the reduction was 92% with the bolus versus 18% with placebo. Most importantly, 79% of patients achieved excellent or good hemostasis within 12 hours of Andexanet administration. This efficacy was consistent across different types of bleeding, including gastrointestinal and intracranial hemorrhage. However, it's critical to note the associated risks. The study reported a 15% mortality rate and an 18% incidence of thrombotic events post-administration, with a notable proportion occurring within 3 days of receiving Andexanet Alfa. While these results are promising, there are significant limitations to consider. This study was single-arm with no control group for comparison. It excluded patients with severe bleeding or those requiring urgent surgery, limiting its generalizability. Additionally, the high cost of Andexanet Alfa, approximately $29,700 per reversal, may affect its widespread adoption. In conclusion, Andexanet Alfa shows substantial potential in reversing the effects of factor XA inhibitors during major bleeding events, but its use should be carefully weighed against the risks and costs. Ongoing trials, like the randomized Study 18-513, will provide further insights into its safety and efficacy. Thank you for watching. Stay tuned for more updates on critical advancements in medical treatments. Don't forget to like, subscribe, and hit the notification bell for our latest videos.